Hello everyone, it's Hyde in the Philippines. Today I want to talk about dental tourism. And that's the main reason I went to the Philippines in the first place. Most guys go there looking for a female. That was part of the plan, but not the initial part of the plan. It was dental tourism. I wanted to get my teeth fixed. And I did. I got these top ones done. Very nicely done. But mainly, my story is about socioeconomics. I'm a welder by trade, a blue collar worker, and depending upon the insurance that you have here in the United States, is how you're going to be treated and received once you hit the dental office. Now, there's different tiers of insurance here, and we all know that. Some insurance is better than others. Now, if you're a factory worker and you're one of the production people, your insurance is going to be different than the office people's insurance. They're going to get a better deal. They're going to get treated different. They're just going to have different insurance. That's not always the case, but most of the time that's the case. So when you walk into the dentist's office, your source of treatment is already pretty much already determined before you get there, because as soon as you hand over your insurance card, they know how they're going to treat you. I mean, they've got it down to a science now, exactly how much they can extract and what you got. And then what they don't factor in is what you can afford, but they figure with the insurance that you have that you really can't afford, much cosmetic surgery. And that's what it comes down to. It's not covered by insurance. If you have a rotten tooth up front, they yank it, and you're not getting a replacement. You have to pay for that. That's called cosmetic because it's a vanity project, and you got to pay for that out of pocket. Okay. So, due to my economic circumstances, I'm middle class, lower middle class, I guess you'd call it. And I've had, decent insurance, and I've had bad insurance. And depending upon what job I've had, is determined what kind of dental care I could have. Most of the time, it hasn't been good. So, like if you get a really bad tooth, a molar or something, 9 times out of 10, the dentist is going to look at your insurance, and he's going to offer you a root canal, but he's going to say, it's really expensive. We could just pull it for about $200. A root canal is going to cost you about $5, $6. So right on the spot, he's already kind of like talking you out of the root canal, which he can't do in the office there 9 times out of 10. He's got to send you to another guy. So that means that's money out of his pocket. And he'd just rather yank that tooth right then and there. It takes him 5 minutes, poof, pops it out, and then he gets to bill you for all these other things. The Novocaine, office visit, blah, blah, blah. Before you know it, that 5-minute procedure to pop that tooth out is now $1,200. It didn't cost you $1,200. Your insurance paid $1,000, and then you paid $200. Okay, that's, you can do some of the math on that. If you've got 32 teeth and they yank them all one at a time, man, the dentist has made some loot. Now, he's made some serious loot. Now, after that's all said and done, and you go to get dentures, which is what's your next step. If you haven't got any teeth, you got to get dentures. And, there's different tiers on that and what your insurance is going to cover and what it's not going to cover. You know what I mean? But most insurances are going to cover the lowest level of denture care that there is possible. So most of my friends are 10 years older than me. I ran with the older crowd, so I've got to see in real time their ailments as they came before them and myself. I got to hear their tales of woe. Now, everybody that got dentures hated the damn things. Everyone, I never heard, they learned how to chew most of their food with their dentures out because their dentures hurt their gums so damn bad, because that's the kind of dentures you can afford when you're middle class. You don't get them good Cadillac dentures. So man, I'm watching, and I'm starting to have dental issues myself. I've had a couple yanked, and I needed some work done, So I'm like, damn, and I've always wanted a pretty smile. It's one of those things that I've wanted my whole life. I've wanted to smile at people, and I know I normally don't smile at people. It's not something I do, If you look at the pictures from, 30 years ago, I don't smile in any of them. I do that, I grin, the face smile. But I rarely showed my teeth because, the top ones were okay, but I have crowding. My wisdom teeth came in like this, so it crowded these and bunched them all up. and that's just a bastion of places for stains to get in. And then, you get coffee stains in there, and they're ugly, and they look like you got rotten teeth when that's not even the case. You just got crowding. Well, anyway, I've always had pretty good top teeth. Well, then, over the years, your top teeth take wear and tear, and where my teeth were straight across this way, the front right here had like a spot like this where just I'm guessing from eating and chewing, and if you're a blue collar worker, your mouth is sometimes your other hand, or you got to use it for whatever it is, and it's another tool in your belt, so it's it takes some wear and tear then over the years. So I started looking into it. I wanted to as I became older, I got paid a little better, and my bills became less, and so I wanted to get my teeth fixed. Now, 3 weeks before the COVID hit, I went to this new place over in Napoleon. I went in there and I asked them, I was like, hey, I'd like you to look at my mouth and see what you could do. I'd like to get, my top teeth taken care of, and, I'd like to know what you could do for me. Well, they went in there, they poked, they prodded. They charged $100 for that visit, x-rays and everything, since it was a new visit. I got the special $100. Well, anyway, after everything was said and done, we went and sat down in the office, and then the lady gave me the breakdown of what it was going to cost me personally after they billed insurance and everything. It was going to come out to about 16 grand just to do the top. Just to do the top. Well, that priced me right out of it. I knew right then and there, I was mad as hell, that, my socioeconomic standing point, I just knew right there I was going to end up like one of my buddies with them big ass fucking horse teeth, that they shoot video, funniest videos on. And I knew that was going to be my outcome. And I had a grandkid coming up, and I could just see her yanking them big old teeth out of my mouth. And, it broke my spirit. It really did break my spirit. And for a second, it broke my spirit for a second, because as soon as I got to the house and that anger flooded through me, I was like, there has to be, a better way, some other place that I could get my teeth done. So I started going online, like the desperate people do, looking for answers. Please help me, Google. And sure enough, Google gave me, choices, and I started going through them, and I narrowed it down to Mexico and the Philippines. Okay, well, at the time, Mexico was just, everything you saw was craziness, all the cartel stuff and all this and that. And it just didn't feel like a safe place for me to go. That's the 100% the main reason I didn't go down to Mexico to get my teeth done, was because of the dangers. I didn't want to get robbed, and, or something bad would happen to me. So then Philippines was my second choice. So the more I looked into the Philippines and was watching videos, and, it's an island, beaches. I was like, well, shit, man, if I'm going to go get my teeth worked on, why not go to an island and get that done? Why not? And then I looked into it, was checking out the prices on things. And like I said, it was 16 G's for just the top here. And then after doing, but that was with, they were just going to put veneers on. That was veneers, and veneers crack and split, and, they stain bad. I mean, everything I looked into that, I was like, well, man, I don't want that at all. And then, like I said, I started looking into the Philippines, and you could get what they called a jacket, which is a tooth on the front. It's a cap, but it fits on the front and the back of your tooth. And all the dentists recommend that that's the best damn tooth that you can get, is a front and a back, all in one tooth. Well, I was like, okay. And then, after more checking, the Philippines just kept coming up as the place. You could look on YouTube and sort of price list and check people's prices and stuff. And so I was like, well, okay, man, I'm going to do the Philippines. So I decided on the Philippines, and then I was watching a YouTube video, and then I happened to contact a guy that rented a place and a scooter. It was $10 a day for the scooter, $10 for the apartment. Well, I wanted to come over, and I figured it was going to take 3 weeks to get everything done. So I talked to this guy, and he was like, hey, I was like, he goes, well, why are you coming? Are you coming to get a girl? And I was like, no, man, I want to get my teeth fixed. It's been a lifelong dream of mine to have my teeth fixed. And it kind of surprised the guy, like, everybody and his brother's coming over here to, meet a girl and their loneliness. And I said, that would be great. That, but that's not my initial reason for wanting to come in the first place. I'm 100% coming. I want to get my teeth fixed. And he goes, well, good news for you, bro, is my girlfriend is in the dental field. She's a secretary at a dental office. And I was like, you have got to be kidding. I mean, coincidence? Sure, who cares? I do not care how it came about. Coincidence or not, hand to God, whoever's stirring the pot, put me in the right place. So I booked my ticket. I head to the Philippines. I brought me a pocket full of money. I'm going to get my teeth fixed. So I get over there to the Philippines. I land. Second day we're there. We go see the dentist. Now we go see my friend's girlfriend's boss. Used to be her boss because she quit and is now with this dude. And, we get to the office, and I could feel that there was something was amiss. I could feel a little tension in the air. I'm good at that. I can read things. And there was some tension in the air. What she didn't know was the boss was kind of was having hard feelings that she quit on her and quit her job on her and left her. So when I got there, she checked me out, and from the prices that I had checked, the basic prices that almost every dentist in the Philippines charges, this chick was charging me like 35% more than everyone else. And she immediately, right then and there, I'd flown all this way, and my friend could see. He goes, man, I could see the minute you broke. I almost started crying because I flew all this way to get my teeth fixed. And this lady had priced me out once again for what I wanted to do, what I'd asked for and what I wanted to do. I was like, this, I can't afford that. I just can't. So we went back to the house, and my friend's girlfriend was like, that's not I know another dentist. We're going to go over to this other dentist. So we went over to this other dentist the next day. And I walked in, and I was like, I was skeptical, all right, because it was one of those things where, it's because my skin is white that they're going to, price gouge me out of, my dream. That's really what I was thinking. That because of my white skin, I was going to get, damn, man, this, being white is not helping at all. Like they say, that white privilege was not playing here. It was going against me. That's what I was thinking. So I go in and I sit down, and there's this very nice, she's a little short woman with the most brightest eyes. And, everybody was wearing a mask back then. They just started letting people back in the country, but everybody was still wearing a mask. So I never did get a good look at her at first, but she had the kindest eyes. And then she looked in my mouth and cleaned me out, and I was like, well, since I'm here, you want to just clean my teeth and, see what you can see. And so she got in there and she cleaned my teeth and worked on me for about an hour. And, I'd come with my x-rays because in the Philippines, you have to go somewhere else and get your x-rays, and then you bring it to the dentist's office because not all dentist office has an x-ray. So anyway, I had my dentist in, she's looking at everything. And, she's telling me what I tell her what I want. I want the jacket. And now there's two types of jackets you can get, which is cap. It's a front and a back. Now you can get the enamel one. And I know a lot of you people have seen people with enamel caps. It's a white tooth, and then it's got that black edge around the outside. Once it starts wearing off, after, you having it for a while, that black edge is going to come because it's enamel over steel, like a bathtub, 100%. And, over time, you start getting that black ring, and I didn't want that. I wanted the zirconian, which is, what it is. It's a zirconian tooth. There's no steel in it whatsoever, and it's strong. It's like, they call it zirconian because it's like the diamond. It's hard. It's hard, and I'm never going to get that black ring. It's always going to be just white teeth. So she sat me down and gave me the price. Now, I was going to get, she gave me the price for zirconium. Now I got 10 zirconium caps. Okay, 10. I got a 3-tooth flexible partial here. And I had 3 cavities fixed and my teeth cleaned. Okay. She told me the price. It was almost $3,500. It was $3,487. So let's just say $3,500. And when she said $3,500, man, it was like all that research and all that effort to get. I mean, I almost cried again. I know it sounds weird. Why are you crying over your teeth? Because, man, over the years, my teeth have just been a source of pain and misery, and emotional pain. Because I'm a reasonably good looking, okay looking guy. I'm no Adonis or anything like that. I own a mirror. I know what I look like. But I'd be in a grocery store and or wherever I was, and I'd see a pretty girl, and a pretty girl would see me, and she would, look at me like, ooh, and then smile at me great big. Now, if somebody smiles at you great big, you almost reflexively smile great big back. And I would smile, and I would see them almost immediately look at my teeth and then look away. I got to tell you, man, that shit hurts your ego. Here I am, I'm a decent dude. But because of my fangs, I've been excluded from the relationship pool. There's other reasons. I used to be a heavy drinker. I haven't drank in a long time, but that's neither here nor there. But I'm just saying, on the visual carpet, when women see you, they're looking at 2 things, a few things, but mainly your teeth and your shoes. So anyway, I always have nice shoes, but the teeth I just did not have. So anyway, she quoted me that price, $3,487, and I was like, I couldn't give her the money fast enough. And then over the course of the next week, she did did an imprint. I was there the first day, and then it was like the third day I came back, and from the imprint, she had made me a fake set that went over my teeth, and she like glued them up in there, and I got to see what my teeth were going to look like. And man, I got emotional as shit over it, because I mean, for the first time, I'd looked in the mirror and I just saw, straight, perfect freaking teeth. The envy of every person I ever seen smile with big, pretty teeth. I had always been envious of, and there I was myself, one of them people. And I was like, wow, that's what I'm going to look like, And she goes, these are just your temporary ones, because it was one solid piece that went around like this and just fit up in there. And she goes, the ones we're going to put are going to be each individual ones. And I was like, man, if this is what they're going to, if that's what it's going to look like, I'm ecstatic. So, over the course of, I believe it was 10 days, I got all my teeth done, and look at them. That was 2 years ago. They're still just as white. I mean, they don't hurt. I haven't had to take an antibiotic because I've had an infected tooth, Now that was my first trip there, and one of the things I want to say is about this doctor. Her name is Dr.Christy, and she's in Mandawi City. And I'm going to try and pin a link up underneath at the end of this video. I'm hoping to pin the link before this video actually gets uploaded. I'm hoping I can do that with an address and everything, because I'm going to tell you, when she fitted me for my jacket, all of them, all 10 of these teeth, it took her 5 hours. Pardon me, 5 hours. Because she shaped every tooth. So when the jacket went up on there, I had a straight smile. I didn't have some, like whopper jawed, looking smile. 5 hours. I went to the bathroom twice because I'm old. Shh, leave me be. I went to the bathroom twice. That woman never left that stool and worked on me for 5 hours. And when it was all said and done, and then, I've never been treated so good. I mean, are you okay, sir? Are you in any pain, sir? Do you need to take a break, sir? Just constantly considerate of me and the patient-client relationship. It was one of those things where she was true. I'd never felt that in a dentist chair before, being treated so well and so concerned over my possible pain, because they just don't ask you. You have to tell them, hey man, that hurts a little bit. You want to, but no, she was asking, 5 hours. And at the end of that 5 hours, just the nicest teeth. And I couldn't be happier. These are the Cadillac of teeth. And I could never afford that here. I priced it here. The zirconian cap here that I got here is $4,000. So just to get the two front ones that were the worst to fix would have cost me 8 G's. And then it would have looked stupid because of all the other teeth. So $8,000 to get that done here in the States. I got everything, like I said, 10 zirconian caps, 3 cavities fixed, a flexible 3-part, 3-tooth bridge, all for $34.87. That was my first trip to the Philippines. Now, I've subsequently went back. Okay, I've been back to the Philippines. I went for 4 months. Now, when I went back, I had other problems. I had, before I left, the dentist had packed my one tooth, and it was like, this should last till you get back, and then we'll cap the other ones. So I had a molar up here on the top, and then a molar back here on the bottom that needed to be fixed and capped. But I was going to wait the 8 months until I got back and get them fixed, which I did. However, when I got back, they had become infected. The one right here on the bottom was infected really badly. And I needed root canals. So I needed 2 root canals. So I got a root canal here, and I got a root canal here. She sent me to her dentist, Dr. Natavio. Great guy. He's a member of a motorcycle club. He treats a lot of expats. Most of his patients are expats, white guys getting their teeth fixed. He speaks great English, drives a Harley, got hair to his ass. Just a, all-around nice guy. I like him. Just as a person, I like him as a person. Good family guy. So anyway, I go over there, and then I get the 2 root canals. I have to pay cash for that. That's $400. Now, normally when you get a root canal here, it's a one-sitting thing. Boom, you're out. Well, like I said, this tooth was infected. So what he did was he cleaned out the infection best he could, and then put these rods down in my in the tooth there with antibiotics in it, and then he sealed it over with putty. Now every 4 days I had to come back, and he'd dig that shit out and then check it to see if it, the infection was going away, and it was, but it was kind of slow. So 3 times he had to put that stuff in there, put the putty down in my mouth, and dig it out. At the 3 times at the 3rd visit, it was done. Now I'm going to tell you right now, that cost me $400, and that was 4 visits to his office. Now, no dentist here in the States is going to spend that amount of time to fix that tooth. They would have said, hey, we just need to yank it. You need to yank that. But he's like, no, I can save it. And he did. He saved it, and then I got this one capped, a nice cap on this one, nice cap on this one. So that cost me $800 for those caps. So here we are, what are we at, $1,200 for that. So 35 plus 12, that's 47. So I'm at 47 currently on my dental bill. Now, before I left the last time, I talked to my dentist. These ugly bottom teeth that I hate so very much, that keeps me away from having that 100% Hollywood smile, I'm going to have fixed when I return. She's going to do, I'm going to get zirconian caps, right? She's just going to grind them down and put zirconian caps over these teeth, and I'm going to be fixed. And it's going to cost me, she said the last quote was $2,500 to get the bottoms done. So for where I'm at, for the money that I've spent or I've invested in myself, it's just been so worth it. so, I mean, so worth it. And the experiences of having gone to the Philippines, along with, this has changed my life. These teeth. I smile at people. I never used to smile at people. I mean, my kids, even when the kids were little, they would say, "Hey, Dad, how come you never smile?" I would go places, and the joke was, you had to buy a smile from me. Uh, I would smile sometimes, but not with my teeth, just because I didn't want to burden you with, my effed up looking fangs. But now I smile all the time. I do it all the time. I mean, and it's infectious. If you smile at somebody great big, they just smile. They can barely, they're like, I don't know what shit, man. And they'll just smile at you. And I do it all the time now. And I can't wait to get these bottom fangs because, man, you're going to have to wear sunglasses around me because I'm gonna make sure you see them on a 20. I'll probably sleep like this, like, hey, baby, how's it going? Check out my fangs. Did you see the new teeth? Because I'm finally, after all these years, I'm gonna finally get that smile. And you know what? And it's kind of funny, but I think I finally, I'm getting it now, but I will be able to use it, in a good way. You know what I mean? Because I've learned how to use this smile, this half a smile right here, and in good ways. I make people smile, and people smile back at you, and I just think the bottom half, once I get that done, that's just going to fulfill, and I'm just going to be a militant smiler. I'm just going to be getting after it, trying to make everybody smile because it's fun to do. You make one person smile. I've made the most grumpy looking SOBs. I'd just smile at them great big and, give them one of these and be like, hey, man, how are you doing? Whew, that looks tough. Hey, you need some help? That kind of stuff right there. I'm more open now. I'm not such a grouch. I mean, for real, a grouch. I don't look pissed off all the time. That's still part of my face, but I mean, I can break the pissed off mode and flash you the fangs. And, it really has changed my life and the things that I attract because I'm more positive, and I've attracted so much positivity in my life just with what may be a simple change, but a life change to me, all these years because of money, and because of money, I was able to get this done. All right, that's what I have to say now, and I can't wait to give you the part two when I get the bottom done. Please like and subscribe. I know this has been a long-winded one. Did you make it all the way to the end? My analytics says most people don't make it till about halfway. But anyway, if you did make it all the way to the end, please like and subscribe. Thank you. Ciao. Be as good as you can.